Hi, my name is Simic, and today we'll be performing an abdominal examination. My patient here today, aka Mr. Smith, will be helping me today. Mr. Smith, before we begin, do you agree to be on videotape today?
Yes.
Okay, thank you. A few questions. Any changes in appetite?
No.
Any recent changes in weight, up or down?
No.
Any abdominal pain or tenderness coming in today?
No.
Any foods that you cannot take due to food allergies?
No.
Any issues with nausea?
No.
Any issues with vomiting?
No.
Any recent recurrent diarrhea or constipation?
No.
Are you currently taking any medications?
No.
Okay, thank you. So we'll start. We'll inspect Mr. Smith's abdomen, looking for symmetry, making sure there's no bulges, bruises, and also checking for contour. From here, contour looks flat, and again, examining at eye level, contour is flat. Checking for symmetry, coming down at the end of our makeshift bed here, abdomen is symmetrical. Umbilicus is midline and inverted. And I will start off in the right lower quadrant. We have the ascending colon. In our right upper quadrant, we have the liver and the gallbladder. In the left upper quadrant, we have the stomach and the spleen. And in the left lower quadrant, we have the descending colon. And up in our right upper and left upper quadrant, you will also find the transverse colon as well. Okay. And Mr. Smith, we're now going to listen for bowel sounds. Starting in the right lower quadrant, listening for a minimum of 15 seconds in each quadrant. Bowel sounds are present in all four quadrants, nor, hypo, or hyper. And now we will go on to auscultation of the cardiac vessels for bruits, starting with the aorta. Oh, I'm sorry. Using the bell of the stethoscope. And coming down to the renal. Down to the iliac, and the femoral. No bruise present at this time. And now we will go on to percussion. Looking for a general tympany. Mr. Smith, you're just going to feel some tapping here. Okay, any pain or tenderness with that?
No.
Okay. Okay, next we'll move on to the identification of the liver borders. There are two ways. First, we'll start placing my hand underneath the 11, 12, supporting underneath, starting at the midline, and slowly palpating. Just breathe normally, moving up 1 to 2 centimeters at a time. Okay, and then the next technique is the hooking technique, which let me move over this way a little bit. Okay. Table's a little big. Standing at the patient's right shoulder, facing towards their feet, coming to the midline. Take a nice deep breath, and seeing if you can feel for the liver, the ridge line. Okay. Any pain or tenderness with that?
No.
Okay. And now I'm going to have you, we're turning back to the assessment for CVA tenderness. I'm going to have Mr. Smith sit up for us. I'm just gonna lift your shirt here. And then I'm gonna kind of tap on your back. You let me know if you feel any pain, okay? Any pain with that?
No.
Okay, thank you. And that concludes our assessment of the abdomen. Thank you.